Eating for two. The phrase eating for two is one of the most misleading pregnancy myths. It implies that a pregnant woman needs to double her food intake, but medically this is far from true. A healthy pregnancy only requires about 200 extra calories a day, which is the equivalent of a small snack like a banana with a tablespoon of peanut butter or a cup of low-fat yogurt. Doubling calorie intake does not mean doubling nutrition. In fact, excessive eating can lead to unnecessary weight gain, increasing the risk of gestational diabetes, preeclampsia, and the need for cesarean delivery. The focus should instead be on nutrient-dense foods. Pregnant women need more folate to help prevent neural tube defects, more iron to support increased blood volume, and more calcium to build the baby's bones. Eating whole grains, lean proteins, leafy greens, nuts, and dairy products provides this balance. On the other hand, highly processed foods filled with sugar, saturated fats, and empty calories may cause harm without providing nutritional benefit. This myth endures because it seems intuitive, but the science makes it clear. Pregnancy nutrition is about quality, not quantity. Belly equals gender. A very popular myth passed through families is that the way a belly looks can predict the baby's sex. If the belly is high, some claim it must be a girl, while a low belly is said to mean a boy. Others insist that a round belly indicates one gender, while a wider shape suggests another. None of these ideas have scientific support. The shape of a pregnant belly is determined by factors such as the woman's body type, muscle tone, the position of the baby, and the number of pregnancies she has had. Medical science offers reliable ways of determining a baby's sex, primarily through ultrasound, chorionic villus sampling, or amniocentesis when needed. Another related myth is that a baby's heart rate reveals gender. A higher rate supposedly indicates a girl, while a lower one signals a boy. In truth, a baby's heart rate changes depending on activity. If the fetus is moving, the heart rate may rise. If the fetus is resting, it slows down. These changes have nothing to do with gender. Relying on belly shape or heartbeat for gender prediction is no more accurate than flipping a coin. Stretch mark creams. Stretch marks are a common concern during pregnancy, and many women turn to creams, oils, or cocoa butter in the hope of preventing them. The myth is that applying these products daily will stop stretch marks from appearing. Scientific evidence shows otherwise. The primary factor behind stretch marks is genetics, not skincare products. If a woman's skin is genetically predisposed to stretch marks, no cream can stop them. Stretch marks occur when the skin stretches faster than its elasticity can handle, commonly during pregnancy as the belly grows. The sudden stretching leads to small tears in the skin's middle layer, causing streaks or lines. While creams and cocoa butter may help the skin stay moisturized, they do not change its elasticity or prevent the underlying structural changes. Excessive weight gain in one area can increase the likelihood of stretch marks. Healthy, steady weight gain during pregnancy, combined with good hydration, may help reduce severity, but prevention is largely out of personal control. This myth persists because skincare companies promote products without strong scientific backing. Alcohol is safe. Many cultures believe that small amounts of wine or beer during pregnancy are harmless or even beneficial for relaxation. The scientific consensus, however, is that no amount of alcohol is proven safe during pregnancy. Alcohol crosses the placenta and enters the baby's bloodstream, where it can interfere with development. This can lead to fetal alcohol spectrum disorders, FASDs, which include lifelong learning, behavioral, and physical challenges. The timing of alcohol exposure is also important. Some believe that drinking later in pregnancy is less dangerous, but research shows alcohol can harm the baby at any stage. Even while breastfeeding, alcohol passes into breast milk, which can affect a newborn. Since every woman's metabolism is different, and every fetus may respond differently, doctors recommend complete abstinence to avoid risk. This myth remains popular because alcohol is socially common, and some women report having drunk small amounts without noticeable harm. But the absence of visible problems does not mean safety. The safest path is total avoidance. Food and fish rules. There is a widespread myth that pregnant women should avoid fish altogether. This idea comes from concerns about mercury and foodborne illness. The truth is more balanced. Pregnant women should avoid fish with high mercury levels such as shark, swordfish, king mackerel, and excessive amounts of tuna. But low-mercury fish such as salmon, sardines, trout, and anchovies are highly recommended because they are rich in omega-3 fatty acids, particularly DHA, which is crucial for the baby's brain and eye development. Similarly, foods like hot dogs and smoked salmon often cause concern. They are safe if properly cooked, which reduces the risk of bacterial contamination like listeria. The real danger lies in undercooked meats, unpasteurized dairy products, and unwashed vegetables. These can transmit harmful bacteria or parasites, including toxoplasmosis. A related myth is that pregnant women cannot pet cats. In reality, it is not the cat itself, but the handling of cat litter that poses a risk of toxoplasmosis. Proper hygiene, wearing gloves, and avoiding direct contact with litter greatly reduce this risk. Instead of complete avoidance, informed choices and preparation are what ensure safety. Exercise and sex. Another common myth is that physical activity or sex can harm the fetus. Some worry that exercise might strangle the baby with the umbilical cord or cause miscarriage, while others fear sex could disturb or injure the fetus. Both ideas are false. Exercise is encouraged during pregnancy unless there are specific medical restrictions. It improves circulation, reduces back pain, lowers the risk of gestational diabetes, and can even help labor progress more smoothly. The myth of strangulation during yoga or certain movements comes from misunderstanding fetal positioning. The baby is surrounded by amniotic fluid inside the uterus, safely cushioned from maternal movements. Similarly, sex cannot physically reach or hurt the baby, as the fetus is protected by the amniotic sac and the strong muscles of the uterus. In fact, sex during pregnancy is considered safe for most women and may even provide stress relief. These myths persist because pregnancy is often surrounded by fear and caution, but the evidence shows that healthy activity and intimacy are not harmful. Inducing labor. Many women near the end of pregnancy hear advice to eat spicy food, walk long distances, or practice yoga to bring on labor. Unfortunately, no food, exercise, or home remedy has been scientifically proven to start labor. Labor begins when hormonal and physiological signals from the baby and the mother align, and it is largely out of external control. Spicy foods may cause digestive changes, and yoga may improve relaxation, but neither induces contractions that lead to delivery. Another connected myth is that natural births are always better. While many women prefer unmedicated deliveries, medical science shows that birth experiences should be individualized. Some situations require epidurals, inductions, or cesarean sections to ensure safety for both mother and baby. The idea that one method is inherently superior creates unnecessary guilt or pressure. The reality is that every birth is unique, and the safest delivery is the one appropriate for the circumstances, not the one dictated by myth. Sleep positions. The belief that pregnant women must sleep exclusively on their left side is widespread, but it oversimplifies the truth. In later pregnancy, lying flat on the back may become uncomfortable because the growing uterus can compress major blood vessels, causing dizziness or lightheadedness. However, the body naturally signals discomfort, prompting a pregnant woman to change positions. Sleeping tilted on the right side or alternating sides is generally safe. There is no evidence that waking up on the back harms the baby. In fact, studies show that most women naturally avoid prolonged back sleeping in late pregnancy due to discomfort. This myth often causes unnecessary anxiety, with women waking in the night worried they have harmed their baby. A more balanced view is to prioritize comfort and rest in any safe position. Adequate sleep is essential for maternal and fetal health, and over-focusing on position can ironically reduce rest quality. But if you think these myths were surprising, wait until you see what's hiding in your everyday meals. From healthy salads to common drinks, some foods can pose unexpected risks during pregnancy. Watch every toxic food that can harm your baby. Explained in detail, where we break down the real dangers one by one.